better to avoid an unwanted pregnancy than to have an unwanted pregnancy and then look for options to terminate it. Hi, I'm Dr. Mithee Bhanot, a senior consultant obstetrician and gynecologist working at Apollo Hospital, Noida. Today we are here to discuss about the contraceptive options or the birth control options available today. We as gynecologists offer a basket approach of contraception. That means there are different choices available, some permanent, some temporary, some reversible, and it is up to the patient to choose what the patient wants according to her needs. So the first option, let's talk about the permanent method. The permanent methods are the ones which cannot be reversed, and they are usually offered to people who have completed their family. Some who have had one kid or two kids and they do not want any more kids or pregnancy. So these are the permanent methods offered to them, being the tubal ligation in females and the vasectomy in males. The advantage is that once you've got this surgery done, there are hardly any chances of failure, and in case there are failure, the failure rate is very less. In let's say 2 in 2000 or 2 in 10,000. So these are the failure rates for the permanent method. Coming to the temporary methods, they are mostly reversible, and we have a basket approach, a lot of options available for the ladies of today. The first and the most common being the barrier method. The barrier method includes the condoms, the female diaphragms, the female condoms. Now these act as a barrier and they prevent the sperms from entering the reproductive tract of the female. And besides offering contraception, the other advantage is that they prevent against the sexually transmitted diseases. So this is a very good option for female who are not on a very regular relationship, and they go in for this as and when required. But yes, the failure rate is very high, and if not worn completely and not worn properly, the failure rate can be as high as 18 in 100. So if we want to decrease the failure rate, there are other options available like the birth control pills. Now the birth control pills are a very important method and a very good method of contraception for people who are in a long relationship or in a permanent relationship. This offers the advantage of a very low failure rate, like almost being 0.1 to 0.4% in 100. So it's a very low failure rate, and it also helps in regularizing the cycles, that means the regularization of the periods. Now this is very good method for people who don't have kids or who want a long interval between the two pregnancies. The third option is intrauterine devices. That means there is a T-shaped device which we insert inside the womb of a lady, and that stays there for 3 years, for 5 years, or sometimes even for 10 years, and it offers contraception. It does not interfere with the menstrual cycle. You get the cycles every month, and for people who are concerned with taking a tablet every day, this is a very good method of contraception. Also, as we age, the ladies have a problem of heavy bleeding during periods, and to counteract that, there is a contraceptive available which is also a T-shaped device inserted inside the womb, but instead of having any normal copper substance, it has a hormone in it, and that prevents the excessive bleeding in ladies, and it offers contraception for 5 years. So we have a lot of options for contraception, and after explaining and after carrying out an examination, it is offered to the patient according to her best needs and demands. Thank you.